So my presentation is over healthcare costs in America. And the question I want to ask you is is healthcare a right or a privilege? I would argue the former. Healthcare costs in America are a barrier to many families and working Americans. Has anyone in here had a family member or they themselves had an unexpected visit to a doctor or hospital in the last year? Even the small sample size we got here. My mom had an unexpected visit to the hospital earlier this year where she was diagnosed with type 1 diabetes. This wasn't any fault of her own. Type 1 diabetes just happens. But type 1 diabetes requires medical supplies, which costs at least $1,000 each week, and that's on top of the hospital costs to begin with. This can be devastating to a young family or anybody who's not planning on these emergencies. So, first we have to determine the problem of I'll explain to you the problems with our healthcare system, their causes, and how you can help fix them. First, we have to determine the problem. Our healthcare system is incredibly inefficient in the name of profit. We spend most on healthcare of any developed country. The per capita cost of healthcare in the United States is $9,892. That's for each and every person. That was in 2016 according to Watson. That's $3,000 more than the next highest spender and 3 times the average. We spent 17.6% of all of the money made in the U.S. on healthcare in the last year. That's $3 trillion. We read 2017. And even with the Affordable Health Care Act passed during the Obama administration, almost 12% of Americans are uninsured. That's according to the CDC. So why do we spend so much on healthcare? That's GDP, and we are well above everybody else. So why are our costs so high? There are several flaws intrinsic with our healthcare system. The first is administration costs make up 25% of spending. This isn't present in other countries which only have one payer. Here we have thousands of different health insurance companies which each have to negotiate with hospitals and other healthcare providers to decide costs. And this creates a lot of overhead. Watson 2016. Healthcare and Medicare, which is our government healthcare provider, cannot negotiate costs for everybody, which would set prices for medicine. And the third reason is partisan politics. In America, we have very polarized politics between Democrats and Republicans, and their platforms are essentially the opposite of each other. So we can't get a lot of reasonable legislation passed. So in summary, prices are kept high by administrative costs, negotiating power, and partisan politics. So how can we solve this?
People have really strong opinions on single-payer healthcare. It could be the silver bullet that fixes our healthcare system, or it could be... But most people don't even know what single-payer means. So let's start with what we have. You can think of the American healthcare system as a series of tubes. We do not have single-payer healthcare. We have thousands and thousands of payer healthcare, and each of them typically pay different amounts for the exact same medical service. And that's a lot of administrative work. For every 3 doctors in the United States, you have 2 billing staff standing behind them, just handling all that paperwork that comes in and out of a doctor's office. If you think of a single payer system, it is just one tube of payments. All money flows from the government to the doctors. And it's actually pretty popular elsewhere. Medicare here in the US is like that. It pays all the healthcare bills for people over 65. But there's also a catch. When the government is the one paying all the bills, they get to decide what they will and will not pay for. If the system isn't funded well enough, if they haven't raised enough taxes from their citizens, that could lead to longer wait times and fewer doctors being available. Vermont right now is trying to set up the very first single-payer healthcare system in the United States. By one estimate, Vermont could save 25%, but it's also expensive. The state government in Vermont needs to raise $2 billion. That is a lot of maple syrup. But people really dislike the American healthcare system. It gets pretty poor marks from Americans. And if you look at neighboring Massachusetts, their healthcare experiment in 2006 did lead to Obamacare. So if this does work in Vermont, who knows what could be next?
So major changes are needed to our healthcare system, and namely in the form of a universal healthcare system or a single-payer system. This would entail extending Medicaid coverage to everybody, and would allow fixed prices and reduced administration costs, as that nicely animated video showed. The highest estimated cost of this would be equal to our current healthcare spending. And the mainline estimate is $1.38 trillion, which is only 1/3 of current healthcare spending in the U.S. Jacobson, 2017. So what can you do about this? You can get in touch with your representatives in Congress. And to find your House representative, you can go to house.gov/representatives/find, or you can just Google "who's my representative," and it will ask you for your zip code. Or you can sign a petition. I have a link here to petitions on moveon.org, and again, you can just Google universal health care petition. So a single payer system would benefit our nation, but it needs your help. Today, we identified the problems in America's healthcare system and their causes, as well as told you how you can advocate for universal health care. Together, we can make every American receive the possibility of life-saving health care they need to live happy and productive lives. And
Awesome.